Today we're talking with Paul Liistro of Arbors of Hop Brook in Connecticut. Paul, we were going to talk today about the problem about reducing unnecessary readmissions to the hospital. What do you have to say about that?
Joanne, there are any number of emerging trends that are testing the industry. Length of stay, quality measures is determined by MDSs, staffing, but the most critical quality metric that we're seeing, something that really makes an impact in the cost of healthcare, is unnecessary readmissions from our nursing facilities back to the hospital. No one ever thought that this was a problem before. In fact, it was not a problem until the federal government, started penalizing hospitals for several different specific cases. And what they have done is to then put the pressure on us to perform so that we can keep a patient in our nursing home, in our post-acute units, safely and without sending them back to the hospital. The difficulty with that is no one's paying us to do it, and it requires resources. And so you have to become innovative in practicing safe admissions and knowing when to send somebody back. It starts with a good electronic medical record that people can add to freely and allow the medical director or the advanced practice registered nurse and nurse practitioner to look at it and to know what's going on, how a patient's developing. Vital signs, blood pressure, pulse ox, respiration are all signs to them that give us a good indication as to whether we should send somebody back or not. But it goes beyond that too. It's knowing how much therapy a patient should get when they come out. It's knowing when to recognize an infection is starting to develop in a wound. If someone's had a hip transplant, for instance, there's a wound that's recovering. Some technology that's been helping regarding infections is airborne infection control monitoring, and there's a business affiliate the American Healthcare Association has called Novartis, and they have rocket science, and they have developed a system that develops a plasma field that destroys bacteria and viruses and VOCs. Those infections created by viruses and bacteria can be eliminated from the air, reducing the ability to infect a wound, for instance. All these little things add up to preventing unnecessary readmission. At the end of the day, it requires communication with the hospital as well, because hospitals nowadays don't give us all the information we want. They're anxious to have someone be discharged from the hospital, so it becomes our problem. It becomes our problem again if we have to readmit them, so it's always nice to know what the level of care is, how sick the patient really is, what the medications are. And that whole medication reconciliation issue is another big thing to worry about. But it's clear this is where the rubber has met the road, and adding more resources to analyzing whether a patient has to go back or not is on everybody's radar screen.
It certainly is. Thank you, Paul, for being with us today.
My pleasure, Joanne, anytime.